This video is all about how emotions affect our health. Emotions drive physiological responses inside us, and we release various chemicals and neurotransmitters, and they have a massive impact on our health. One of the commonest things that we talk about is stress, and it's in our common language, and it's a word that we use all of the time. You may say, "I'm really stressed about my exam next week." Or you may say, "I'm really stressed about my divorce." The two things are very different in terms of stress and how they affect us, however. One of them could be considered a good stress, and one of them could be considered a bad stress. When we take an exam, we have a short burst of stress. So we may get very worried about it in the lead up, and we prepare and we practice and we put ourselves to be in the best possible place to take that exam with the hope that we're going to pass it. We come to the exam, we do the exam, and then afterwards, all of the stress dissipates and we return to our normal state. That is often determined as being good stress. The other type of stress is bad stress, and that can be the kind of stress that you undergo when you're going through a divorce. That stress can be there all day, every day, for days on end. There may be peaks where your stress gets very intense and then it goes away a little bit, but it doesn't go away entirely. And that's chronic stress, and that is very bad for our health. As humans, we have evolved to respond to short bursts of stress, the so-called fight or flight response, where we get ready to fight or we get ready to run away from the danger. This is normal stress, and after the stress has passed, we can breathe a sigh of relief, we recover, and we get over it, and we go back to our normal state. When we're under chronic stress, we never get the chance to rest and recover, and this can impact us both emotionally and physically. Some of the common symptoms that happen when we're stressed include feeling exhausted, headaches, poor concentration, poor sleep, gut symptoms, and also feeling quite low and flat and sometimes depressed. It's well known that negative emotional states can have an impact on how we behave. Often, when we don't want to feel like that, we adopt poor behaviours that aren't very good for us. Some examples of what we do to avoid feeling bad as a result of chronic stress include things like drinking too much alcohol, smoking, taking drugs, overeating or undereating, and not bothering about our physical health in the way of taking any exercise. It's not surprising to hear that some of those behaviours can lead us to developing chronic diseases. Problems like blood pressure, certain cancers, type 2 diabetes, and addictions are all associated with poor behaviours. There have been other studies which link things like being angry to having an increased risk of cardiovascular problems. And certainly when you're angry, it's common to get surges in your blood pressure. It's well known that when people are in a negative state of mind, that they often report more severe symptoms, whether that's an acute illness or a chronic illness. So their symptoms of a common cold may feel far worse than if they were in a positive state of mind. And if they have a chronic illness, they may be more likely to report increased amounts of pain. It's not all bad news, though. Positive emotions can have a beneficial effect on our health. When we laugh, we release beta endorphins, and these chemicals help to boost our mood. They also make our bodies release a kind of growth hormone, which is useful to help us repair our cells. Also, when you feel good, you're far more likely to indulge in healthy behaviours. You may be more inclined to exercise. Studies have shown that going outside for a walk for even just half an hour at a time can really help to lower stress levels and boost your mood. I don't know about you, but whenever I've done a workout, I never feel worse. It's sometimes hard to do it. It's sometimes hard to be motivated to get going and do that workout. But afterwards, those feel-good chemicals are circulating, and I'm always really pleased that I made the effort to do it. It's important to add that it's not normal to feel positive all the time. And negative emotions are just as important as positive emotions. But what I think is important is that we should strive to achieve more of a balance between the two. Having an awareness of the stressors in your life and having an awareness of how they're making you feel is a very important first step to achieving that balance. When you understand the impact that stress and your emotional state can have on your physical and mental health, it enables you to make little changes. By making a small change to your mindset, you can make baby steps towards changing your physical and your emotional health. It's not easy to do it, but with a little bit of work, when you become aware of what's going on, that empowers you to make those changes and to move forwards.